Hello everyone, and a big warm welcome to our channel. I'm thrilled you're joining me today because we're about to embark on a really important discussion, one that touches so many lives. We're going to be talking about something crucial for every woman navigating the vibrant years beyond 40, understanding and proactively managing your health. As we age, our bodies go through remarkable changes, and with these changes can come new health considerations. It's not about fear, it's about empowerment through knowledge. Today, we're diving into an important topic, the common illnesses that affect women over 40. We'll explore what they are, why they become more prevalent, and most importantly, what you can do about them. Think of this as your personal guide to understanding your body better, recognizing potential warning signs, and feeling confident in the steps you can take to protect your well-being. Knowledge is power, especially when it comes to your health. Our goal here is to arm you with information, inspire you to have those important conversations with your doctor, and encourage you to make choices that support a long, healthy, and energetic life. It's about thriving, not just surviving in these wonderful years. So get comfortable, open your mind, and get ready to learn. Stay tuned to learn more and take charge of your health. We're in this together, and I'm here to help you every step of the way. All right, let's start with a condition that often sneaks up silently, but can have a profound impact on your life, especially as you move past 40. Osteoporosis. Many of you might have heard the term, but do you truly understand what it means for your bones? Osteoporosis literally means porous bones. Imagine your bones, which are normally dense and strong, becoming more like a honeycomb with larger spaces and thinner walls. This makes them fragile and much more susceptible to fractures, even from a minor fall or a simple bump. It's a major health concern, and women are disproportionately affected. The statistics are quite telling. Did you know that millions of women over 40 are living with osteoporosis, and many more are at high risk due to low bone mass, a condition called osteopenia? The impact isn't just about broken bones, it's about potential loss of independence, chronic pain, and a diminished quality of life. A hip fracture, for instance, can be a life-altering event, leading to long recovery times and sometimes permanent disability. We want to avoid that, and understanding the risks is the first step. So why are women more vulnerable, especially after 40 and leading into menopause? A key player here is estrogen. This hormone plays a crucial role in maintaining bone density. As estrogen levels decline during perimenopause and menopause, the rate of bone loss accelerates significantly. It's a natural process, but one that we need to be acutely aware of so we can take proactive measures to counteract its effects on our skeletal system. This isn't something to be scared of, but it is something to be prepared for. One of the trickiest aspects of osteoporosis is that it's often called a silent disease. You might not experience any symptoms at all until a fracture occurs. This is why screening is so incredibly important. You can't feel your bones getting weaker, so you need to have them checked. Don't wait for a break to find out you have a problem. Early detection allows for early intervention, which can make a world of difference in preserving your bone health and preventing debilitating fractures down the line. The gold standard for diagnosing osteoporosis is a bone mineral density test, often called a DEXA scan. It's a simple, painless, and non-invasive procedure that measures the density of your bones, typically at the hip and spine. Your doctor can help determine when you should start having these scans based on your individual risk factors, which include family history, your own medical history, certain medications, and lifestyle choices. This scan provides a crucial snapshot of your bone health. Now, let's talk about what you can do. The good news is there's a lot. Lifestyle plays a massive role. First, nutrition. Are you getting enough calcium and vitamin D? Calcium is the building block of bone, and vitamin D helps your body absorb that calcium. Think dairy products, leafy green vegetables, fortified foods, and for vitamin D, sunlight exposure and supplements if needed. We need to fuel our bones properly every single day. Then there's exercise. Weight-bearing exercises are your bone's best friend. These are activities where your bones and muscles work against gravity, like walking, jogging, dancing, or even climbing stairs. Strength training is also incredibly beneficial, as it builds muscle, which in turn supports your bones and improves balance, reducing the risk of falls. It's never too late to start incorporating these into your routine. Even gentle forms can be beneficial. If you are diagnosed with osteoporosis or significant osteopenia, don't despair. There are effective medications available that can help slow bone loss, and in some cases, even help build new bone. These treatments, combined with lifestyle modifications, can significantly reduce your fracture risk. Your doctor will discuss the best options for you, weighing the benefits and potential side effects. It's about creating a comprehensive plan tailored to your specific needs. The long-term consequences of unmanaged osteoporosis can be severe, leading to a stooped posture, chronic pain, difficulty with daily activities, and an increased risk of further fractures. This is why prevention and early management are key. Even if you're in your 20s or 30s, building strong bones now is like putting money in the bank for your future health. Peak bone mass is typically reached by your early 30s, so the stronger your bones are then, the better off you'll be later. Finally, let's not forget the emotional impact. Living with the fear of falling or dealing with the pain of a fracture can be challenging. Support from family, friends, and healthcare providers is essential. Understanding the condition and knowing that you're taking active steps to manage it can empower you and alleviate some of that anxiety. Remember, you are not alone in this, and there are resources available to help you live well with osteoporosis. Next up, we need to talk about a true heavyweight in women's health, and that's heart disease. For too long, heart disease has been mistakenly perceived primarily as a man's disease. But let me be crystal clear. Heart disease is the leading cause of death for women in many parts of the world. This isn't just a statistic, it's a reality we must confront head-on, especially as women enter their 40s and beyond, when risks can increase significantly. One of the critical things to understand is that heart disease can present differently in women compared to men. While men often experience the classic Hollywood heart attack symptom of crushing chest pain, women may experience more subtle or atypical symptoms. These can include unusual fatigue, shortness of breath, nausea or indigestion, pain in the jaw, neck or back, dizziness, or a feeling of anxiety. Because these symptoms can be less dramatic, they are sometimes dismissed or misdiagnosed, leading to dangerous delays in treatment. So, what are the risk factors we need to be watching out for? Many are well-known: high blood pressure, high cholesterol, especially LDL or bad cholesterol, smoking, and diabetes. But for women, there are other factors to consider. Family history plays a role, as does obesity and a sedentary lifestyle. Furthermore, conditions like polycystic ovary syndrome, PCOS, and complications during pregnancy, such as preeclampsia or gestational diabetes, can also increase a woman's long-term risk of developing heart disease. The hormonal changes that occur during menopause also play a significant part. The decline in estrogen levels is associated with an increase in several cardiovascular risk factors. For example, blood pressure may rise, LDL cholesterol may increase while HDL, good cholesterol, may decrease, and fat distribution can shift towards the abdomen, which is a known risk factor for heart disease. This is why the years around menopause are a critical window for focusing on heart health. Regular checkups with your doctor are absolutely paramount. This means getting your blood pressure checked routinely, having your cholesterol levels monitored through blood tests, and discussing your individual risk factors. Don't be shy about asking questions. Inquire about your numbers, what they mean, and what your target levels should be. This proactive approach allows for early detection of any issues, often before they become serious problems. Knowledge here is truly your best defense. Now let's talk about the powerful impact of lifestyle modifications. A heart-healthy diet is foundational. This means focusing on whole, unprocessed foods, plenty of fruits, vegetables, whole grains, lean proteins like fish and poultry, and healthy fats like those found in avocados and nuts. It also means limiting saturated and trans fats, added sugars, and sodium. Small, consistent changes can make a big difference to your cardiovascular health over time. Regular physical activity is another cornerstone of heart health. Aim for at least 150 minutes of moderate-intensity aerobic exercise per week, like brisk walking, cycling, or swimming. Strength training a couple of times a week is also beneficial. Exercise helps control weight, lower blood pressure, improve cholesterol levels, and reduce stress, all of which are good for your heart. Find activities you enjoy so you're more likely to stick with them. Stress management is an often overlooked but vital component of heart health. Chronic stress can contribute to high blood pressure and other risk factors. Incorporate stress-reducing practices into your daily life, such as mindfulness, meditation, yoga, deep breathing exercises, or spending time in nature. Ensuring you get adequate sleep is also crucial, as poor sleep can negatively impact your heart. Your mental well-being is intrinsically linked to your physical heart health. It is so important not to ignore potential symptoms, no matter how vague they may seem. If you experience persistent or unusual fatigue, shortness of breath with minimal exertion, unexplained pain, or any of the other atypical symptoms we discussed, please see your doctor. It's always better to get checked out and be reassured than to dismiss something that could be serious. Trust your instincts and listen to your body. It often knows when something isn't right. Finally, understand that heart disease is often interconnected with other health conditions common in women over 40, such as diabetes and even some autoimmune conditions. Managing one condition well can often have positive ripple effects on others. Taking a holistic view of your health, understanding these connections, and working closely with your healthcare team to manage all your risk factors is the most effective strategy for protecting your precious heart. Now, let's turn our attention to another significant health concern for women, particularly as they age: breast cancer. This is a topic that understandably evokes a lot of emotion and perhaps some fear. But my goal today is to replace that fear with empowerment through knowledge, because when it comes to breast cancer, early detection is an incredibly powerful tool. It can dramatically improve treatment outcomes and, quite frankly, save lives. We need to be vigilant and proactive. The cornerstone of early detection is regular screening. For most women, this means mammograms. A mammogram is a low-dose X-ray of the breast that can detect abnormalities, sometimes even before they can be felt as a lump. The guidelines on when to start mammograms and how often to have them can vary slightly, so it's essential to have a conversation with your doctor about your personal risk factors and what screening schedule is appropriate for you. Don't put this off. It's a vital checkup. Alongside professional screening, breast self-awareness is key. This means becoming familiar with the normal look and feel of your breasts so that you're more likely to notice any changes. While formal monthly breast self-exams are less emphasized now than general awareness, knowing your body is crucial. Changes to look out for include a new lump or mass, swelling, skin dimpling or puckering, nipple retraction, turning inward, redness or scaliness of the nipple or breast skin, or nipple discharge other than breast milk. Understanding your risk factors is also important. Age is a significant one. The risk of breast cancer increases as women get older. A family history of breast or ovarian cancer, particularly in a first-degree relative, mother, sister, daughter, can also elevate your risk. Certain genetic mutations like BRCA1 and BRCA2 significantly increase susceptibility. Other factors include a personal history of breast cancer, dense breast tissue, early menstruation, late menopause, and certain lifestyle factors. It's also important to know that breast cancer isn't just one disease. There are different types, and they can behave differently and respond differently to treatment. Understanding the specific type of breast cancer, its stage, how far it has spread, and its characteristics like hormone receptor status helps doctors tailor the most effective treatment plan for each individual patient. This personalized approach to treatment has led to significant advancements. The good news is that treatment options for breast cancer have evolved tremendously over the years. Depending on the type and stage, treatments can include surgery, lumpectomy or mastectomy, radiation therapy, chemotherapy, hormone therapy, targeted therapy, and immunotherapy. Many women today who are diagnosed with breast cancer, especially when it's caught early, go on to live long, full, and healthy lives. There is a lot of hope. I cannot stress this enough. If you notice any change in your breasts, no matter how small or insignificant it may seem, please see your doctor promptly. Don't wait to see if it goes away or gets worse. Most breast changes are not cancer, but it's essential to get them checked out to be sure. Early diagnosis allows for more treatment options and generally leads to better outcomes. Your awareness and quick action can make all the difference. The journey through breast cancer diagnosis and treatment can be emotionally and psychologically challenging. It's vital to have a strong support system, which can include family, friends, support groups, and mental health professionals. Many organizations offer resources and support for women affected by breast cancer. Remember, you don't have to go through this alone. Seeking and accepting support is a sign of strength. While not all breast cancers can be prevented, a healthy lifestyle may help reduce your risk. This includes maintaining a healthy weight, being physically active, limiting alcohol consumption, and eating a balanced diet rich in fruits and vegetables. If you have a strong family history or other significant risk factors, your doctor might discuss additional risk-reducing strategies, such as genetic counseling or preventive medications. Hearing survivor stories can be incredibly inspiring and offer hope. Many women have navigated this path and emerged stronger. Their experiences underscore the importance of vigilance, the advancements in treatment, and the resilience of the human spirit. Let their journeys remind us of the power of early detection and the continuous progress being made in the fight against breast cancer. Stay informed, stay aware, and prioritize your breast health. Let's move on to another common health issue that becomes increasingly prevalent for women after 40, and that's type 2 diabetes. This condition affects how your body uses sugar, glucose, for energy. Essentially, your body either doesn't produce enough insulin, or it can't effectively use the insulin it does produce. This is called insulin resistance. Over time, this leads to high blood sugar levels, which can cause a cascade of health problems if not managed properly. The prevalence of type 2 diabetes has been rising, and women over 40 are certainly not immune. In fact, factors like hormonal changes associated with menopause, potential weight gain, and a tendency towards a more sedentary lifestyle can increase the risk during these years. It's a serious condition, but the encouraging news is that type 2 diabetes is often preventable, and for those who do develop it, it's highly manageable with the right approach. What are the symptoms to watch out for? Sometimes type 2 diabetes develops gradually, and symptoms can be mild or even go unnoticed for a while. However, common signs include increased thirst and frequent urination, unexplained fatigue, blurred vision, slow healing sores or frequent infections, and sometimes unexplained weight loss, though weight gain is more common as a risk factor. If you're experiencing any of these persistently, it's worth a chat with your doctor. Several risk factors can increase your likelihood of developing type 2 diabetes. Being overweight or obese is a primary one, as excess body fat, especially around the abdomen, can contribute to insulin resistance. A sedentary lifestyle, meaning not getting enough physical activity, is another major culprit. A family history of diabetes also plays a role, as does having had gestational diabetes during pregnancy or having polycystic ovary syndrome, PCOS. Advancing age itself is also a risk factor. Prevention is truly powerful when it comes to type 2 diabetes, and the strategies are largely centered around healthy lifestyle choices that benefit your overall well-being. Maintaining a healthy weight is crucial. Eating a balanced diet that's rich in whole grains, lean proteins, fruits, and vegetables, while limiting processed foods, sugary drinks, and unhealthy fats is key. Portion control is also important. Think of your plate as a canvas for health. Regular physical activity is another non-negotiable for diabetes prevention. Aim for at least 150 minutes of moderate-intensity aerobic exercise per week, plus strength training. Exercise not only helps with weight management, but also improves your body's sensitivity to insulin, allowing it to use glucose more effectively. Even small increases in activity, like taking the stairs or going for a daily walk, can make a difference. If you are diagnosed with diabetes, please know that it's not a life sentence of deprivation. Effective management involves several components. Regular blood sugar monitoring is essential to understand how your body responds to food, activity, and medication. Depending on your situation, management might involve oral medications to help lower blood sugar or improve insulin sensitivity. And for some, insulin injections may be necessary. Lifestyle changes remain paramount even with medication. It's critical to manage diabetes effectively to prevent or delay long-term complications. Uncontrolled high blood sugar can damage blood vessels and nerves, leading to serious problems like heart disease and stroke, kidney disease, nephropathy, nerve damage, neuropathy, especially in the feet, eye problems, retinopathy, that can lead to blindness, and an increased risk of infections. This is why consistent management is so vital. Regular checkups, including A1C tests, which measure your average blood sugar control over the past few months, are vital. Working closely with your healthcare team, which may include your primary care doctor, an endocrinologist, a dietitian, and a diabetes educator, will help you create a personalized management plan. They can provide guidance on diet, exercise, medication, and self-monitoring. Making sustainable lifestyle changes can feel daunting, but support is available. Diabetes education programs and support groups can be incredibly helpful, providing practical advice, encouragement, and a sense of community. Learning from others who are navigating similar challenges can be very empowering. Remember, small, consistent steps lead to big results in managing diabetes and living a healthy, active life. Our final topic today, but certainly not the least important, is arthritis. This is a very common concern for women over 40, often bringing with it unwelcome companions like joint pain, stiffness, and reduced mobility. The term arthritis actually encompasses over 100 different conditions, but the two most prevalent types we see in this age group are osteoarthritis and rheumatoid arthritis. Understanding the differences and the available strategies for management is key to maintaining your quality of life. Osteoarthritis, OA, is often referred to as wear and tear arthritis. It occurs when the protective cartilage that cushions the ends of your bones wears down over time. This can affect any joint, but it most commonly impacts the hands, knees, hips, and spine. Women are more likely than men to develop osteoarthritis, particularly after the age of 50, and factors like excess weight, previous joint injuries, and genetics can play a role. The pain often worsens with activity and improves with rest. Rheumatoid arthritis, RA, on the other hand, is an autoimmune disease. This means your body's immune system mistakenly attacks its own tissues, specifically the lining of your joints, the synovium. This causes chronic inflammation, which can lead to pain, swelling, stiffness, and eventually, joint damage and deformity if not treated effectively. RA often affects smaller joints first, like those in the hands and feet, and typically affects joints symmetrically, for example, both wrists. It can also cause fatigue and general malaise. The symptoms of arthritis can significantly impact daily activities and overall quality of life. Simple tasks like opening a jar, walking upstairs, or even getting a good night's sleep can become challenging. The chronic pain and stiffness can be frustrating and debilitating, sometimes leading to feelings of isolation or depression. That's why seeking a proper diagnosis and developing a comprehensive management plan is so important. Don't just assume joint pain is an inevitable part of aging. Diagnosing arthritis usually involves a combination of a physical examination, a review of your medical history and symptoms, and sometimes imaging tests like X-rays or MRIs. Blood tests can also be helpful, especially for diagnosing rheumatoid arthritis, by looking for specific inflammatory markers or antibodies. An accurate diagnosis is crucial because the treatment approaches for osteoarthritis and rheumatoid arthritis can differ significantly. When it comes to treatment, the goals are to reduce pain, improve joint function, and prevent further damage. For osteoarthritis, management often includes lifestyle modifications like weight management to reduce stress on weight-bearing joints, physical therapy to improve strength and flexibility, and pain-relieving medications, such as acetaminophen or non-steroidal anti-inflammatory drugs, NSAIDs. In severe cases, joint replacement surgery might be an option. For rheumatoid arthritis, early and aggressive treatment is key to controlling inflammation and preventing joint destruction. This often involves medications called disease-modifying anti-rheumatic drugs, DMARDs, which can slow the progression of the disease. In recent years, a class of drugs called biologics has revolutionized RA treatment for many, targeting specific parts of the immune system involved in inflammation. These can be highly effective, but require careful monitoring. There have been some exciting recent advancements in arthritis treatment. Beyond biologics for RA, researchers are exploring new pain management techniques, innovative physical therapy approaches, and even potential regenerative therapies. For osteoarthritis, there's ongoing research into medications that might slow cartilage degradation, though lifestyle management remains the cornerstone for now. Staying informed about new options through your doctor is always a good idea. It's incredibly important to stay as active as possible, even when dealing with arthritis pain. Low-impact exercises like swimming, cycling, tai chi, and yoga can help maintain joint flexibility, strengthen supporting muscles, and reduce pain without putting excessive stress on the joints. A physical therapist can help you develop an exercise program that's safe and effective for your specific condition. Listen to your body and pace yourself. Learning joint protection strategies can also make a big difference. This involves using your joints in ways that minimize stress and strain. For example, using larger, stronger joints to carry objects, avoiding prolonged static positions, and using assistive devices when needed can help manage symptoms and preserve joint function. It's about working smarter with your body, not necessarily harder, to navigate daily life with greater ease. We've covered a lot of important ground today, from protecting your bones with osteoporosis awareness, to understanding your heart's unique needs, the power of early breast cancer detection, strategies for diabetes prevention and management, and navigating the challenges of arthritis. My deepest hope is that this information hasn't overwhelmed you, but rather has empowered you. Knowledge, when acted upon, is the most potent tool you have for shaping a healthier future. Remember, your health journey after 40 is unique to you, but you are not alone. The key is to be proactive, to listen to your body, and to build a strong partnership with your healthcare providers. Don't hesitate to ask questions, seek second opinions if you feel the need, and advocate for your well-being. These years can be some of the most vibrant and fulfilling of your life, and taking charge of your health is fundamental to enjoying them to the fullest. Thanks for watching. If you found this video helpful, please show your support by giving it a thumbs up, sharing it with other incredible women in your life who might benefit, and don't forget to subscribe for more health tips and information. We're committed to bringing you reliable, actionable advice. Take care of yourselves, prioritize your health, and stay healthy. We look forward to seeing you in the next video.